Welcome viewers, Dr. JWAU. Australia disappeared. The hospital was still open. That wasn't the same as having healthcare. The hospital doors were open, the lights were on, doctors were working, nurses were moving between patients. Nothing looked abandoned. But at 11:46 that night, he was still waiting. The son had been sick all evening. He had called ahead. There was nowhere else to go. So they sat beneath fluorescent lights while the waiting room slowly filled. An elderly man coughed into his sleeve. A toddler slept across two chairs. Another family quietly asked how much longer. Nobody knew. The hospital existed. Access was something different, and that distinction was beginning to appear elsewhere. The school existed, but the classroom was crowded. The road existed, but the commute kept lengthening. The GP clinic existed, but the next appointment was days away. The suburb existed, but services had not expanded as quickly as the number of people depending upon them. And this is where population, infrastructure, and household pressure collide. More people can mean more workers, more customers, more taxpayers, more voters, more economic activity. But people do not arrive as numbers on a spreadsheet. They require homes, doctors, teachers, roads, water, transport, energy, hospitals, food. And when capacity fails to keep pace with demand, scarcity appears as waiting. Waiting for housing, waiting in traffic, waiting for appointments, waiting for classrooms, childcare and services. Each delay seems survivable until millions of Australians begin organising their lives around systems that technically exist, but increasingly cannot provide what they need when they need it. Viewers, at 2:18 a.m, her son was finally seen. They drove home completely exhausted. The hospital had done its job. Nobody could say healthcare had disappeared. But somewhere between existing and being reliably available, another piece of Australia she thought she lived in had become harder to find, because right before our eyes, Australia disappeared.